Right. Good afternoon, everyone, and welcome to Open Dialogue. I know that please get comfortable and hopefully everyone has their sandwiches and snacks. The Open Dialogue is, we're talking about local research with global impact. My name is Brian Thompson and I'm the CEO of the Dalhousie Medical Research Foundation. First, I'd like to acknowledge that Dalhousie University is located in Mcneil, the ancestral and unceded territory of the Mcneil. We're all treaty people. Today, we're here to talk about health research and the incredible impact it can have locally and around the globe. More importantly, we're here to talk about the outstanding research taking place right here at Dalhousie's Faculty of Health, Dentistry, and Medicine. Health is key to an improved quality of life, and health research is providing us with solutions to the conditions and diseases that impact each of us. Prevention, faster diagnosis, better treatments, and ultimately cures are the outcomes of health research excellence. The Nova Scotia health research ecosystem is really going through a major paradigm shift. A more collaborative approach to improving health outcomes is quickly becoming the new reality. Health research in Nova Scotia is leading the way by staying at the forefront of innovation. We're applying new strategies and techniques that address some of the most pressing health issues locally with impact that spans the globe, as you'll certainly hear from our researchers today. The foundation itself was founded 40 years ago in 1979 by the dean at the time, Dean Hatcher, and a group of private citizens who realized that there wasn't enough funding happening from both a public and private perspective to fund medical research in the area. We envision a collaborative environment where research helps prevent the onset of severe mental illness, immunotherapies that teach our immune system to fight cancer, evidence-based initiatives that help our children become healthy and active. Crucial research data is accessible on a broader scale. Cutting-edge biomaterial technologies advance treatment outcomes and our body's ability to regenerate. And accurate Alzheimer's diagnosis leads to timely interventions. Just some of the major initiatives that are taking place right here at Dalhousie. Today, you'll have the opportunity to hear from researchers who are leaders in these trailblazing areas. At DMRF, our mandate is to support health-related researchers at Dalhousie by fundraising to provide the best resources available to bolster their leading-edge work. And it's working. Dalhousie's Faculty of Medicine, Health, and Dentistry produce pioneering research that is world-renowned and internationally competitive. Together, we are advancing research and improving health. And now, it is my pleasure to introduce today's moderator, a consummate communications professional and the vice chair of our foundation board, Ms. Janet Mcneil. Janet is currently serving as interim assistant vice president of communications and marketing for Dalhousie. Janet has devoted much of her professional and board governance career to guiding and supporting successful organizations in their growth, trajectories, and breakthrough moments. I've witnessed it myself. She serves as lead strategic counsel to some of National Public Relations Atlantic clients and teams, a firm she co-founded and co-owned. She works with clients in sectors like health, education, resources, renewable and traditional energy, as well as commercial and infrastructure development. Janet is a member of the Institute of Corporate Directors, a fellow and accredited life member of the Canadian Public Relations Society, and is certified by the US-based Institute for Crisis Management and the International Association of Public Participation. Welcome, Janet.
Hello, everyone. So as Brian said, I'm Janet Mcneil, and I'm so pleased to be here today to have an opportunity to introduce and moderate this panel. For 6 years, I've been a proud member of the Dalhousie Medical Research Foundation Board, and I really, like you, have a very vested interest in health research. Because I know the difference that health research can make. It saves lives, it improves quality of life, it gives years back to those who have been given a terrifying diagnosis, and it brings comfort where there might have been pain. And it's not just about hope, it's about results. It takes these exceptional researchers years of challenging education, time away from personal pursuits, commitment to developing and maintaining an advanced skill set, and of course, it takes a dedicated, compassionate, and curious mind. Today, we've invited just a few of Dalhousie's exceptional health researchers to discuss their remarkable research and how it has or how it will impact the health as we know it. As Brian said earlier, health is a key part of a good quality of life. It's therefore my pleasure to introduce the members of our esteemed panel, who will each be speaking on their research areas of expertise. And afterwards, they will engage in an interactive question period. And I think what I'll do is just introduce every one of them and then get out of the way and let them take over the day. So first up, Dr. Shashi Gujar. He is an assistant professor of pathology, biology, and microbiology and immunology, as well as a cancer researcher with Dalhousie's Faculty of Medicine. Shashi and his team focus on educating our own immune system to fight cancers. Immunotherapies represent the most promising modern age modalities for the treatment of cancers. And these immunotherapies promote anti-cancer immunity, which not only eliminates existing cancer cells, but also maintains an active surveillance against future cancer relapse. And I've had the pleasure of being in a few presentations and rooms with him, and I love to hear him talk. Shashi and his team discovered that oncolytic, I'm going to get all this wrong, but I've tried, viruses known for their cancer-killing properties additionally re-educate the immune system to recognize, attack, and eliminate cancer cells. And indeed, such awakening of the immune system is believed to be key to achieving long-term cancer-free health. Dr. Gujar aims to develop innovative and clinically desired immunotherapies for the prevention and treatment of cancer. So welcome, Shashi. Next, we have Dr. Sara Kirk. She is a professor of health promotion and the scientific director of the Healthy Populations Institute at Dalhousie University. Sara's research seeks to understand how we can create supportive environments for chronic disease prevention. Her research uses a socio-ecological approach that takes into account how individual behavior is influenced by broader factors such as income, education, and societal norms. She has led or collaborated on several nationally funded projects that focus on the creation of supportive environments for health promotion in different settings, including in schools. Recently, Sara and co-lead Dr. Camille Hancock-Friesen were awarded a $5 million matching grant from the federal government for the Uplift initiative. And it was widely covered in the news. Some of you may have already heard about this. The announcement took place a couple of weeks ago. Uplift is a partnership designed to build on best practices that already exist in many schools and communities, like the internationally recognized Health Promoting Schools model. Its components include youth engagement and leadership, systems change, sharing successes, and evaluating impact. The philosophy, need, and value of Uplift is underpinned by research from Dalhousie's Healthy Populations Institute. Uplift is the first partnership in Nova Scotia to receive funding of this type from the Public Health Agency of Canada. So welcome, Sara, and congratulations. And now we have Dr. Daniel Boyd. Now, when I met him recently in a Dal Medical Research Foundation board meeting, he was introduced as Dr. Daniel Boyd, but then for the rest of the session, he was called Danny. So I don't know. Are you Danny or Daniel?
Danny is it.
Okay. He is an associate professor of the Department of Applied Oral Sciences, School of Biomedical Engineering at Dalhousie University, as well as the co-founder of ABK Biomedical. He's a globally recognized inventor of several inorganic polymer technologies in various life science sectors, including orthopedics, dentistry, and oncology. Danny's gained global intellectual property protection for a wide range of inorganic polymers. Daniel, I'll just try the other name, has extensive experience in medical devices and biomaterials. He's centered on bone regeneration and growth, oncology, pharmaceutical delivery, and in oral health. He's a co-founder of a number of companies, including ABK Biomedical and IR Scientific, and has governance experience in both public and private sectors. He currently serves as an associate professor in the Faculty of Dentistry at Dalhousie University in Halifax, Nova Scotia. So welcome, Danny. And last but certainly not least, we have Dr. Sultan Darvish. Originally from Tanzania, Dr. Sultan Darvish completed a PhD in organic chemistry in 1983 and a postdoctoral fellowship in molecular biology in 1984 at the University of New Brunswick, before studying medicine at Dalhousie Medical School and then joining Dalhousie's neurology residency program. Sultan's journey has seen him wearing a multitude of hats: neurologist, chemist, professor, assistant dean of research, research associate, co-founder and director of the Maritime Brain Tissue Bank, scientific co-founder of Treventis Corporation, and as the DMRF Irene MacDonald Sobey Chair in Curative Approaches to Alzheimer's Disease. All incredibly significant titles, but perhaps none as important as his role as a leader in the global efforts to develop a definitive test for Alzheimer's disease during life. For nearly a decade, Dr. Sultan Darvish has been on the hunt for a way to definitively diagnose Alzheimer's disease in people while they are still alive and before their cognitive functions have slipped below the threshold that allows for independence and quality of life. The only way to confirm diagnosis and determine the cause of dementia with certainty is to look at brain tissue under the microscope after death. Dr. Darvish and his team want to change that, and he's here today to talk to us about a recent breakthrough in his research that could make an important difference in treating this devastating disease. So welcome, Sultan. So thank you all for joining us today. And at this time, I'm going to